I hadn't had my period. I hadn't developed at all. I would get mistaken for a guy.
The doctor didn't give us any explanation of why.
I knew in my heart that the doctor had lied to me.
I woke up and I was gasping for breath. And then I lost consciousness.
Why was this happening again?
Next, two medical mysteries that defied the experts. When 16-year-old Jeanne Nollman undergoes ovarian surgery, she has no idea her case file holds the key to an unimaginable medical cover-up.
I felt betrayed. I was so angry. I had to go see this doctor and confront him. I knew that my life would never be the same.
Then, when Mary Brown endures a series of mysterious lung collapses, she's forced to face a devastating reality that no doctor can explain.
There were hundreds of little cysts throughout both lungs.
It was quite difficult.
As a child living in rural New York in the 1970s, Jeanne Nollman was surrounded by her large, happy family.
I had two sisters and a brother growing up, and we were all a year apart.
Jeanne loved being the oldest. She liked to run all the birthday parties, and she organized all the games and usually won all the games.
We did a lot together as kids growing up. We were all very close, and we had a large group of kids around our block, and we played every day during the summer and the winter on the weekends.
Jeanne was just a typical little girl. She played with dolls and liked to dress up in my wedding dress.
That was pretty exciting for me, to fantasize about my wedding someday. I was always intrigued by the dresses and the wedding parties and the ritual.
And while she's preoccupied with typical childhood fantasies, Jeanne is also passionate about sports. And despite suffering from occasional bouts of asthma, she's in perfect health. But strangely, Jeanne shows no sign of entering puberty, even as her 13th birthday comes and goes.
I hadn't had my period. I hadn't developed at all. Every day I would look in the mirror and look and see a lack of breast development. That was kind of shocking for me, to see my sister get her period at 11, and I was 13 years old. It didn't seem fair that she was getting that before I was. My mother would constantly tell me, "Oh, Jeanne, don't worry, you're a late bloomer." And so I kept on just trying to have some faith that, okay, it's going to come eventually. And so going into high school, I was nervous that I might not fit in. People were making jokes about me being flat-chested or looking like a boy when I was 14. I was getting seriously worried that my body was failing me and I wasn't having that same experience as other girls. Their shapes were changing. Boys were interested in them. Boys weren't interested in me. And I was just all alone with my feelings. And I did a lot of reading, and I particularly enjoyed reading adult love stories. They were a great escape. I fantasized a lot what it would be like for me to have that type of grown-up life and a beautiful female body. I would read about all these voluptuous women, and that sounded wonderful to me, especially because it was something unattainable at that time.
While Jeanne's mother continues to remind her that it's just a matter of time, to be certain, she sets up an appointment with the family physician.
The pediatrician thought she was delayed in puberty because of her chronic asthma and didn't think it was a problem. We assumed that the pediatrician had prior experience with children with asthma and delayed puberty, and so I took his word.
And he said it wasn't unheard of for girls to get their period at 15, 16, 17. Hearing that, it didn't help, because that wasn't going to make me more popular. that wasn't going to make me look any differently in the mirror.
Over the next 2 years, Jeanne's body remains essentially the same. In fact, the only way it changes just makes her even more self-conscious.
By the time I was a junior, I was probably about a 5'7". Not only was I getting taller, but then I wasn't developed, so I didn't look very different than my brother at that time. And that was disappointing and upsetting. I think that was kind of like a turning point, where there's got to be something wrong. It made me feel alone in my feelings, in what I was going through.
I was getting concerned there was something wrong.
Just to be safe, Barbara takes Jeanne in for her first gynecological exam.
I was alone in the room with the doctor, and I didn't know what to expect. And the doctor attempted to put the speculum inside of me. I just sat right up and remember yelling out, "Stop, stop, it's not gonna work, don't do it." Because I was experiencing pain right away.
The doctor is completely baffled. Her vagina appears to be underdeveloped, causing Jeanne immense pain when he tries to examine her vaginal canal.
He was having difficulty being able to perform a normal type of gynecological examination because my vaginal area was too small at the time. I don't recall this doctor seeing anything like this before. The doctor didn't have any suggestions as to what it could be. He said they were going to have to order very specialized tests that were going to cause me to be hospitalized. I was glad finally, okay, we're going to find out what's going on here. While I was in the hospital, they did some blood work and they collected my urine. They did some x-rays and scans. I had no idea what they were looking for. It seemed like a lifetime waiting for those results.
Finally, 5 days later, the findings come in, and they leave Jeanne and her family reeling.
The doctor said I wasn't producing any hormones because my ovaries hadn't developed enough, and that's why I didn't go through puberty.
The doctor didn't give us any explanation of why.
Already overwhelmed, the Nollmans are stunned to learn that undeveloped ovaries like Jeanne's usually form cancerous tumors. In fact, the risk is so high, the doctor recommends removing her ovaries.
I was worried, and I was very confused as to what this all meant for me. I knew that my life would never be the same at that point.
At 16 years old, Jeanne Nollman's body still looks like a boy's, and she hasn't gotten her period yet. Doctors are certain that her ovaries are undeveloped and unable to produce estrogen. Now, they've just dropped another bombshell. The odds of Jeanne developing cancer are extremely high if her ovaries aren't surgically removed.
I certainly didn't want to have cancer, so I felt very obligated to comply with whatever the doctor said because I didn't want to die.
When we heard the word cancer, we definitely wanted her to have the operation.
The following week, Jeanne bravely goes to the hospital with her mother. And the next morning, she's wheeled into surgery.
When I woke up, they told me that they removed all of the ovaries. It felt very exciting and promising that all I went through was over.
But while Jeanne is relieved, she must now face a harsh reality.
I was shocked that I wasn't going to be able to have children. I don't think I processed those feelings.
Of course, I was upset that she wouldn't be able to have children, but that was just a fact of life, and we just dealt with it.
And the very next morning, Jeanne begins taking estrogen, which will essentially force her body into puberty.
The doctors told me that they were putting me on the highest dosage possible for the rest of my life.
We thought, well, okay, now that problem's taken care of, and she'll mature.
I felt like I had a new lease on life. I would be developing breasts, and my body would change.
2 weeks later, Jeanne returns home. And it's not long before her body begins to transform.
My breasts were budding. It took about 8 months before my vaginal opening was developed. My waist was more defined because my hips were fuller. I liked the new body because it felt more female. And I felt like nobody was going to question my femininity. Seeing my body change was very exciting. And I was starting to feel like, okay, I'm going to have this normal female experience, and I'm going to have guys pay attention to me and look at me. I let my hair grow really long, and I would wear very tight-fitting clothes because I wanted to show off that my body was different, and I wasn't trying to hide in clothes anymore.
I was happy that the problem was behind her and that she could go forward in life and do whatever she wanted to do.
And in the spring of 1978, when Jeanne graduates from high school, she feels ready to take on the world.
I enrolled at the University of Arizona, and that was like a dream come true. I felt like that was finally going to be a real fresh start in my life. I was most looking forward to having relationships and dating, and I was looking forward to being sexually active. I went dancing, I went on dates, and it felt really, really good to get that attention. At that point, I thought that the surgery had worked, the hormones had worked, and I was good to go for the rest of my life.
But gradually, over the next 2 years, Jeanne's hopes of looking like any other girl are dashed.
I continued to grow taller. By the time I was like 21, I got to the height of 6'1". I'd always been very muscular as a child and as a teen, but at 6'1", it brought me unwanted attention. Sometimes I would get mistaken for a guy, and it was a constant reminder there was something wrong and I was different. I didn't have any tall relatives to say, yeah, I could come from here or there. At that point, I decided that I would try to figure out the real truth.
Determined to get some answers, Jeanne contacts the hospital where her ovaries were removed 5 years ago.
I decided that I needed to get my records, and the response was that I'd never been at the hospital. I was incensed, and that confirmed for me that there is something that they're hiding.
When doctors told Jeanne Nollman that her ovaries never developed, she had them removed. But a bizarre growth spurt at age 21 has left her wondering if the doctors told her the whole truth. And when the hospital at which she had the surgery claims it has absolutely no record of her, Jeanne flies across the country, determined to get to the bottom of her case.
When I got to the hospital, I told them that I had requested my records, and they said I'd never been there. And I made a big scene. And I said, you better find my records. And lo and behold, within a few minutes, they located the records and were going to send them to my doctor. It wasn't traditional in the 80s for patients to be able to get their own records, so I had to trust that they were going to actually send the records to my doctor in Arizona. About a month later, my doctor called me and told me that she'd gotten the records. And I knew by the tone of her voice that there was something important in there.
Jeanne's physician recommends that a specialist take a look at the file and sends it to Dr. Marcel Cedars, a reproductive endocrinologist at the University of California at San Francisco.
I got very limited records that described exactly what they did during the surgery and kind of their indications for surgery.
While her doctors at the time had told Jeanne that they were removing her undeveloped ovaries, the report says something very different. In fact, as Dr. Cedars can see from the file, Jeanne never had ovaries.
When she had her surgery, they took her gonads out.
Gonads are structures in a fetus with the potential to turn into either male testes or female ovaries.
I felt very upset that they told me that I'd had an underdeveloped ovary because, in fact, I never had an ovary or a testy. It was neither. And so I knew they made that up. I was just blown away that they would let me live my life not knowing what really had occurred.
Based on their indications of surgery, I can tell that they knew that she had Swire Syndrome.
Swire Syndrome is a very rare genetic condition in which an individual is born with an XY chromosome but develops female reproductive organs except for ovaries. In a healthy fetus, a gene on the Y chromosome switches the gonads on to become testes. The testes then manufacture two key hormones, testosterone, which creates male characteristics, and anti-Müllerian hormone, which suppresses female characteristics. But in patients like Jeanne, the gene that signals the gonads malfunctions, and they fail to become testes or ovaries. Some female characteristics develop, but without ovaries to make estrogen, the body can't enter puberty.
Jeanne has an XY chromosome, and traditionally we think of XX as being female and XY as being male. But it's not really having a Y that makes someone male or female. It's particular genes on the Y chromosome. Swire syndrome is a defect of genes on the Y chromosome, and there is no male development.
When she told me that I had XY chromosomes, I was shocked. This was nothing I had ever heard of. I couldn't have even conceived of it.
In Swire syndrome, the cells that would normally develop as the testicle don't develop, and you're missing Müllerian inhibiting substance. Müllerian structures are what goes on to develop into the uterus and the fallopian tubes, and so those structures will develop normally. The second thing is there's an absence of testosterone. All of the things that we think of as maleness are driven by testosterone. And if there is no release of either testosterone or Müllerian inhibiting substance, the pathway goes into a normal female developmental pathway.
However, while Swire patients develop a uterus, vagina, and fallopian tubes, without a second X chromosome, their gonads never become ovaries.
They really are completely normal women, except that there's no production of estrogen, so then there's no onset of puberty.
It made sense that I couldn't go through puberty because I had no estrogen coursing through my body.
Jeanne's lack of estrogen is also directly related to her height.
Part of the reason that Jeanne is taller is because she has a Y chromosome, and one of the genes for height is on the Y chromosome. Also, typically growth occurs in puberty. The later you go into puberty, the taller you will be because you've already gained height before the growth spurt. So if she'd gone through a more normal female timing of puberty, then she would have been shorter.
And while broad shoulders like Jeanne's are common among women with Swire syndrome, surprisingly, some of her other distinctive characteristics are not.
Jeanne had some increase in her jaw size. That isn't typical necessarily of Swire syndrome. I don't think it's typical for women with Swire syndrome to be more masculine. They don't get masculinized in terms of excessive hair growth. They don't have different muscle mass than a normal female.
Swire syndrome is one of the more rare disorders of sex development.
I believe it's estimated to be about 3 to 5 per 100,000 births. So it's pretty unusual.
And Dr. Cedars is able to assure Jeanne that while she was given a false diagnosis 5 years ago, removing the gonads is the standard treatment for Swires.
People estimate anywhere from 30 to 60% chance that the gonads will have tumor formation. And so the recommendation is once you diagnose a woman with Swire syndrome, that you go to surgery and take the gonads out.
I was able to accept the diagnosis But I couldn't accept that the doctors hadn't been truthful with me.
We were very upset about that, the fact that the doctor lied to us.
I think perhaps in the past there was a lot of concern about a patient's ability to accept that diagnosis.
I felt betrayed by the doctors. Why couldn't they have told this to me? I was so angry that I felt I had to go see this doctor and I had to confront him.
Five years ago, Jeanne Nollman's doctor deliberately withheld important information about her health. Now, the 21-year-old is on her way to confront him and find out why he lied to her.
I was livid, and I showed up unannounced because I wanted to make sure that I would catch him. And I said, "How could you have not told me the truth?" And he said, "Oh, I thought I was doing the right thing, and I thought it would affect your identity, and, I just wanted you to be okay." And I let him know that what he did had a very negative impact on my life. That lying to me was far more damaging than hearing the truth. That experience was so cathartic. It really helped me move on to another phase in my life. After I got the diagnosis, I think I finally was able to process some of the emotions that I probably should have experienced at 18 or 19. Finally, I was able to grieve that I couldn't have a child. I felt propelled to open a new chapter of my life.
After graduating from college, Jeanne begins a career as a social worker and eventually moves to San Francisco, where she finds the man of her dreams.
Bob and I worked together as counselors, and I really respected him more than any man I'd ever met. I really liked him.
I saw her and was interested in her and asked her out, and then we went out from there.
The first month I was with Bob, I knew that he was really special. I was nervous about telling him about my chromosomal status because I'd never really liked anybody so much as I did with him.
When she told me that she had this condition, I was taken aback a little bit. I didn't understand it. I asked her, "Well, does that mean that you are a male?" And she was like, "No." But the more she talked about it, the more it didn't matter.
After going out for about 2 years, Bob asked me to marry him. It was a fairy tale come true.
She looked gorgeous. She just looked like a vision to me.
I had promised Bob that we would adopt 2 children, and so 3 years after we got married, we adopted my son. A year and a half after we adopted my son, my daughter was born, and we adopted her.
Today, Jeanne is healthy and living her life to the fullest.
I'm amazed that I've managed to marry the man of my dreams, somebody that I'm still in love with, and have 2 children. My son, Kenny, is currently 18 years old, and my daughter, Kiana, just turned 14. They're magnificent children. They make my life very rich.
Gina's doing fabulous. She's just so well balanced. She doesn't let her disorder be a negative. It's made her a better person and has made the whole family better because of it.
I don't know if Jeanne is who she is because of it or if it's the other way around. But Jeanne has always been a strong person. I couldn't be prouder of my daughter. She is the greatest.
What I want Swire's women to know is that this doesn't have to be the end of your life getting this type of diagnosis. It could be just the beginning and realizing that you become a woman a little differently than others, but that you're just as much a woman as anyone else, and that you can have a fantastic life.
While Jeanne Nollman felt there was something very wrong with her from an early age, Mary Brown was the picture of health until a mysterious series of symptoms turned her life into a living nightmare. In the summer of 1993, 35-year-old Mary Brown was in the prime of her life. She and her husband John loved raising their 2 children in Southern California, and Mary had become a pro at juggling a very busy schedule.
I've worked for the Santa Barbara County Education Office as a speech and language pathologist and as a special education teacher. I loved my job and I loved my work with children.
Growing up, my mom was a powerhouse. She was charismatic, outgoing.
In her free time, Mary is just as energetic, working out several times a week.
I exercised 2-3 hours a day. I liked cycling. I liked step classes. We did a lot of hiking in those days.
We had to be in shape to do the hikes, because a lot of times we'd be carrying, if it wasn't a pack, we'd be carrying the kids.
I never had any significant health problems at all.
That summer, Mary takes the children to celebrate the 4th of July at her mother's lakeside house in Michigan. On July 3rd, she goes to bed, looking forward to the next day's celebration. But she has no idea what is about to happen.
About 3 o'clock in the morning, I woke up and I was gasping for breath. And I was seeing little black spots across my vision. And I called out as loud as I could, "Mom, something's wrong." And then I lost consciousness. My mother called 911 right away. The ambulance arrived within minutes, and the EMT workers began CPR resuscitation.
I remember seeing my mom being brought out of the house on a stretcher. They had a respirator around her face, and I thought, oh my God, my mom is dead.
"35-year-old Mary Brown has always been in perfect health. But during a visit to her mother's, she wakes up in the middle of the night, unable to breathe, and then suddenly collapses, completely unconscious. Now she's in an ambulance, racing to the closest ER.
The first thing that happened at the hospital was that the emergency room doctor listened to my chest and immediately took an x-ray and confirmed what he'd suspected, that I had a collapsed lung. And they told me it was an 80% lung collapse.
A collapsed lung, or pneumothorax, is a condition in which air escapes from a hole in the lung and builds up in the chest cavity. Eventually, the air presses on the lung until it collapses. Left untreated, the condition can be fatal.
The air that was trapped in my chest cavity was starting to impinge on the function of my heart.
With her heart slowly shutting down, the medical team rushes to insert a tube into Mary's chest to pump out the trapped air.
As soon as they started pumping the air out of my chest, I felt better. I immediately started coughing and inhaled very, very deeply.
They described it like a balloon deflating, and that they blew it back up so that it was okay now.
The doctor said that it was a spontaneous pneumothorax and that I shouldn't worry about it because it would probably never happen again. And at the end of 5 days, I was discharged.
I was ecstatic when she was able to leave the hospital, and we were so happy that she was over this traumatic situation and we're together again.
But over the next 3 years, Mary finds that she's increasingly winded when she exercises. And one day in the spring of 1996, while forcing herself to jog, her difficulties come to a head.
I could not go on, and I sat on the ground. I felt panicky, first of all, because I couldn't breathe. I took big gulps of air. I tried to not panic. I had never experienced anything like that before. I went to see a pulmonologist, and he gave me a lot of breathing tests, and I performed at about 80% of normal. And it took a lot of effort even to get just 80. And he believed at that point that I was probably suffering from exercise-induced asthma.
Exercise-induced asthma is a condition in which heavy breathing during vigorous exercise irritates the lungs' airways, causing them to contract or narrow.
The doctor prescribed an inhalant that I should take before exercising, and that would keep my breathing up.
The inhaler helps, but as time goes by, Mary is able to do less and less.
Over the years, the shortness of breath did get worse. I was very frustrated that I was not getting better.
My mom had a lot of trouble going on the hike she used to do very easily.
I had to stop frequently to catch my breath.
But any hope Mary has that her condition will improve comes to a shocking end in August of 2000.
We were preparing for a family vacation, so I was packing up the van. In order to fit more in the van, I decided to take out one of the chairs. When I lifted the chair, I realized that I shouldn't have done it right away because I felt the pain in my shoulder, I felt shortness of breath. And I also had this odd feeling of bubbles going up my back. I realized I must have another lung collapse, and it was on the right side.
We rushed to the ER. Because it happened on this other side, it was a great concern. It was a mystery. Why was this happening again?
We went right in to see the doctor, and as soon as he listened to my breathing sounds, he said, "I believe you have another lung collapse." I was pretty upset.
Once again, doctors hook her up to a chest tube and reinflate her lung.
And that was a tough time. I was so frustrated. We were told that she couldn't have another lung collapse.
And once she's stable, her doctor performs a CT scan to examine the lung more closely. And the results are completely shocking.
There were probably hundreds of little cysts throughout both lungs.
A cyst is a thin-walled bubble filled with air or fluid. It can appear anywhere, has multiple causes, and is usually benign.
And some of them were as big as a nickel or a quarter, and many were like the size of the top of a straw. The doctor explained that the number that I had and the size of some of them was not typical. It was a little sickening to look at, actually.
But when doctors perform a biopsy, they're even more perplexed by what they find.
The pathology reports came back negative.
I was glad that it was nothing obvious, but I was worried that it had to be something. But it was very scary knowing that they didn't know what was causing the cysts.
Baffled, Mary's medical team can't do anything but release her with instructions to continue using her inhaler.
They didn't change my diagnosis of exercise-induced asthma, and I understood that I was getting all the treatments that were available for what they knew at that point. But I got concerned and worried, not having answers.
She was very frustrated. Mary got frustrated enough to try to find answers and to get another opinion.
My pulmonologist suggested that I go to this special hospital. Maybe they had some answers for me.
Mary immediately schedules an appointment and begins counting down the days.
A month later, my husband and I flew to Denver for an appointment at the National Jewish Hospital.
But halfway through the flight, she notices a frighteningly familiar pain in her left shoulder.
I could tell that there were some clicking sounds, some pain, just some odd things happening to my left lung. And I turned to my husband and said, "I think I have another lung collapse."
Over the past 7 years, Mary Brown's lungs have collapsed twice, and scans have revealed more than 100 mysterious cysts growing in them. Horrifyingly, no doctor can explain the frightening symptoms. Now, while on a plane to Denver for a consultation with a new specialist, she suddenly feels her lung collapse yet again.
It felt the same way the other two had felt. I felt the bubbles going up and down my back. I felt the pain in my shoulder. I felt shortness of breath. I just didn't believe it.
The minute the plane lands, she and John rush to the hospital, where pulmonologist Dr. Ron Balkasoon takes over her case.
She was admitted to hospital and had chest tubes put in to deal with this collapse of her lung.
The doctor did a complete exam. He read my chart, looked at all the records that I had.
We looked at Mary's CT scan. She had the presence of these rounded structures that look like cysts. So we had a suspicion of what this might be, but there were additional tests that we wanted to do to rule out other conditions. And so Mary had actually had biopsies done before, and we wanted to obtain that.
A few days later, the pathology department receives the tissue sample, and their report confirms Dr. Balkasoon's hunch.
On the basis of our clinical findings, Mary was diagnosed with lymphangioliomyomatosis, which is also called LAM.
Lymphangioliomyomatosis, or LAM, is a rare lung condition. In a healthy individual, contraction and relaxation of smooth muscle cells in the lungs play a crucial role in delivering oxygen into the bloodstream. But in patients like Mary, for some unknown reasons, these cells are both overproduced and abnormal. As a result, not enough blood and oxygen can get to the lungs. And so, experts suspect, the healthy tissue dies and is replaced by cysts.
LAM impairs blood flow to the lung and has an impact on the ability to move oxygen into the lung. Both of these will likely lead to a decrease of nutrients being supplied to the lung tissue itself. There's a breakdown or necrosis of lung tissue, and the lung responds by the formation of cysts.
I was very upset to learn that I had LAM, and my reaction was, I don't want to have LAM. That's not a good one to have.
Even more unsettling, Dr. Balkasoon can't tell Mary and John what triggered the onset of the disease. But the current theory suggests that LAM is genetic.
The good thing for me is that it is not an inheritable genetic defect, and that kind of gave me hope that my children won't have this.
But while the disease is most likely congenital, Mary's first symptom, her collapsed lung, was caused by one of the cysts bursting.
The bursting that occurs in the lung from these various cysts is a purely random event, and we still don't understand exactly why. These cysts will form throughout the lung, but when they form on the very edge of the lung, they can eventually pop or burst. And when they burst, air starts to escape out of the lung, and it collects in the space between the lung and the chest wall. The chest wall is a very rigid structure, whereas the lung is really collapsible, much like a balloon. So what happens is that air that's building up will push the lung down because it really can't push out and expand the rib cage. And this is known as a pneumothorax or as a collapsed lung.
As her disease progressed, Mary's ability to breathe while exercising was increasingly limited.
Their airways become compromised by the smooth muscle infiltrating them, and as a result, they have obstruction of their airways. If Mary's condition had not been diagnosed, it would have continued to deteriorate. As these different structures become more and more obstructed by these smooth muscle cells, the person's function begins to decline. After a period of time, you can actually have a destruction of the airways. When these become infiltrated by these smooth muscle cells, they actually start to break down and form these cysts. Over time, with numerous cysts forming, there actually is a weakening of lung mechanics.
Lung tissue is being destroyed by the smooth muscle cell invasion.
Unfortunately, as it stands at the current time, there is no known cure for LAM.
That was very hard to accept, that there's nothing I can do about this. There's no medicine I can take. That's very hard.
At the current time, according to her CAT scan, she has about 40% of involvement. And so she will likely, over the ensuing 10, 15, 20 years, have a progressive decline unless we find some newer therapies that can be used. And she may ultimately need to be considered for lung transplantation.
I was told that you can't survive on less than 25%. So I know that in my future there might be a lung transplant, but I hold on to that as like the last resort. I have a last resort.
And it was of grave concern to us. It certainly changed the way we looked at life. and how long we have on this earth. It was quite difficult.
When she kind of went through the prognosis with me, I was utterly shocked. I couldn't believe it.
Fortunately, some effects of the harrowing disease can be slowed down.
After the initial shock wore off, after I learned more about it, then I realized that I could still have hope.
Probably about 20 to 30% of the individuals who have LAM can use bronchodilators that actually will cause relaxation of that smooth muscle to open up the airway. Exercising regularly and keeping the rest of their body fit is essential. So if a person keeps fit and they utilize oxygen more efficiently, then whatever air they are able to get into their lungs, they're going to be able to use more efficiently and participate in more activities of daily living.
As Mary struggles to grasp the gravity of her diagnosis, she can't help but wonder why Dr. Balkasoon was the only physician able to recognize the disorder.
First of all, LAM is so difficult and tricky to diagnose because it's exceedingly rare. We know that there are at least 800 individuals in the United States who have this condition. And the clinical features can certainly be seen in many other more common lung diseases such as asthma.
I think that my mom was relieved when she found out because she knew her enemy and she was going to beat this thing.
Today, Mary is doing amazingly well, determined to face her disease with hope and optimism.
I work out a lot. I think it helps my health. I consider my lungs, just like every moment in my life, to be like fine china. It's precious. I've learned everything I can about LAM, and I am now working with the LAM Foundation.
I'm really proud of my mom and how she's handled her diagnosis. I think a lot of people would fall victim to self-pity and just give up. But my mom fights it by going out and exercising every day, and she's not giving in. She hasn't changed. She's still a powerhouse.
I tell Mary every day that I love her so much and I'm so grateful of our life together.
Every day I wake up and I go, shoot, I have LAM, but the next thought in my head is I'm also just Mary, a teacher, a wife, a mom. And I get a lot of value in my life from being those other things.